So, good evening, everyone. Thank you for joining us for our annual panel presentation. This year, we're going to focus on detention decision-making during the pandemic. But before we move to the speakers panel, I'd like to ask Pierre McClough, BID's Assistant Director, to give a brief report on BID's work in the past year. Pierre?
Okay, thank you, Maggie. I have been told that I've got 5 minutes and I'm going to put myself on timer for 4. And I'm not going to summarize everything that BID has done because it's been such an incredible year. Let me just say that as far as staffing within the organization goes, we had a few changes. We had our longest serving legal manager who's been with us since the foundation of BID leave us, Ian L. Dimitrescu, so I want to extend our thanks to him. Celia Clark, our director, went on medical leave, but of course continued working while she was on medical leave. As I'm sure many people who know her will not be surprised, and continued to contribute to the organisation. We also recruited a former legal manager during the pandemic, Tom Nunn, with whom we retain good links now. He's joined Duncan Lewis. And we recruited a new member of staff just before the end of our reporting year. She started in September, and that's Aranya Kogolathas, who you're going to hear from this evening. With all those changes, we have maintained output that is really quite surprising, particularly when the one huge benefit of the pandemic was the dramatic reduction in the numbers of people in immigration detention. It's taken a disease as horrendous as the pandemic to lead the Home Office to release people who should not be in detention at all. But to give a snapshot, there were 313 people in immigration detention in IRCs in May, compared to 1,727 in the previous year. But there has been a slight reduction, I think, over the years of the use of immigration detention. And before the pandemic happened, we were wondering why some of the detention centres were not as full as they could be. And there was a lot of speculation that it could have been in preparation for Brexit. And there's no doubt that, given the rhetoric that we see, that I think that a lot of those concerns have been well founded and do not augur well for the coming year. Nevertheless, during the pandemic, and I don't want to go in too much detail because I'm sure Adam will touch on this, but we have had an amazingly positive outcome of cases, and our publication, which will be touched upon this evening, Risky Business, is testament to that and evidenced the amazing work of our legal managers, who achieved at certain points a 91% success rate in bail outcomes. And on average, I think since the pandemic began, we've still been successful at around 88%. I'm sure Adam could correct me on that. In normal years, we would have a success rate of about 56 to 59%. That's what it's been like for the last 5 or so years. That compares to the statistics of the IAC, which between 2017 to 2019 is a bail granting rate of around 30%. So BID really does punch about above its weight. The shock of the pandemic for us, however, has been the loss of our volunteers. And it is something I think that has had a huge impact upon our legal managers, who effectively had to take on all the work themselves, preparing bail applications. And they responded so positively. I mean, it's it's a point of concern really in a way that the response, because of the pandemic, at a time when BID was writing to the Home Office and asking for the immediate release of people, the response of our staff was to work tremendously hard to try and get as many people out as quickly as possible for their own safety. I mean, it is extraordinary that while we campaign for the end of immigration detention completely, during this past year, the government has insisted on detaining people in confined situations despite the pandemic, and on deporting people or on holding people when it was obvious that removals could not take place, as no one was flying planes to enable them to take place. So in that context, I think, you know, if I'd like to hold up a glass, really, a big thank you to all members of staff at BID, because we were hit by the pandemic really hard, and we've really carried the whole issue forward. We've enabled, which can't be summarized here, but it's in the annual report, we've enabled a lot of casework that has contributed to developments in our policy work, developments in our strategic litigation. So thank you to all of them who've been at the coalface and who have been working with people who have been so unfairly treated and detained. That's it. Thank you. That's 5 minutes, I think.
Thank you, Pierre. Well managed time there. Thanks very much. Right, can I just say that if people have any questions throughout the evening, perhaps you could slot those into the Q&A as we go along. But in order to make things manageable, we're going to take questions at the end rather than during the session. So thanks, Pierre. So now we're going to move on to our first speaker. Our first speaker is Mr. A, who's a former BID client who was detained during the pandemic. He's going to be interviewed by Aranya Kagulathis, our BID legal manager who worked on his case. They're going to discuss his experience of being detained in prison and of catching COVID while detained, despite being asked to shield by the NHS. As his case is ongoing, he's going to be joining us with audio only. So Aranya and Mr. A, over to you.
Thanks, Maggie. Mr. A, do you just want to take yourself off mute? Thank you. Thank you for being with us today to share your experiences. We really, really appreciate it. So we know that you were detained in prison under immigration powers. Can you tell us a bit about how you ended up in immigration detention within a prison?
Initially, I've been convicted of an offence when I was 18, and it was for a joint enterprise offence. And for that offence, I have sentenced to imprisonment for in a royal institution. Also, I came to the UK when I was 8, and I went to school and I did everything here. And then when I committed an offence, the Home Office said like I wasn't British and I had to be deported.
So you came to the UK when you were 8 years old. You got convicted of an offence. It was a joint enterprise offence, and you were sent to a young offenders institution. How long did you say that your sentence was supposed to be?
It's supposed to be 3 years.
And when were you due to be released?
My release date initially was on February 2020.
And when were you actually released?
I was released on December 2020.
So you essentially served 10 months on top of your sentence?
Yes.
Yeah. Why did the Home Office decide to detain you for so long?
Because I was not born in this country. I was not born in the UK, so I was initially born in France. So they tried to deport me to France.
So essentially, they kept you in immigration detention in order to deport you, and you haven't been deported. Why were they unable to deport you for 10 months?
Well, I won my appeal first, and then because when I won my appeal, the Home Office appealed against it. So now the case is still ongoing, and it needs to be reheard in court.
So throughout the time that you were in immigration detention, they weren't able to deport you because your appeal was ongoing the whole time. And in fact, you even won your appeal at one stage.
Yeah.
Yeah. You were detained between February and December 2020, which was during the pandemic. How
Yes.
did you feel about being held in prison during that time?
During the COVID-19 period, it was really scary. During that time, also I have asthma, so I thought that yeah, if I caught the COVID-19, I thought I would die, and at the same time, the prison, because we was on lockdown, we couldn't see our family or friends.
Yeah. So as we all know, asthma is a very relevant pre-existing condition. Were the prison aware that you had asthma?
Yes, they did.
They did. And what, if any, steps did they take in prison to try and protect you?
Well, they gave me that. Well, they came and they said to me that I should shield, and I have accepted it, and so they put me in a different wing where everyone that are high risk to the COVID-19, they've moved me up to a different wing.
So you were moved to a different wing in prison. Did the Home Office say they knew about the fact that you had asthma, and did they try and review your detention in light of that?
They actually sent me a letter saying that I do not have any health issues, so I am not at risk.
And we also know that the NHS wrote to you separately and said that you needed to shield. So you had the Home Office saying one thing, that you didn't have any pre-existing conditions and that you could remain in detention, and then you had the NHS and the prison saying that you were vulnerable. So
yeah, that's right.
Yeah. So unfortunately, despite shielding, we know that you did get COVID-19. When did you contract COVID-19?
I contracted COVID-19 around November 2020.
And what symptoms did you experience?
I had no taste. Also, I had a headache. I was sweating a lot. I couldn't move my leg. They were hurting. I was shaking a lot, and because of the COVID-19, it activated my asthma, so I was coughing a lot, and then my chest was hurting, and because of that, I knew that I had it, and I was getting like stressed, anxious, because I've seen the news. When I was watching the news, I saw a lot of people dying.
That must have been really, really stressful. What was the healthcare like in prison when you had COVID-19?
The healthcare board in prison, in each wing, there's only like one healthcare in every wing, so they weren't always there.
They weren't always there.
Yeah, that's right.
You spoke to me previously about one of your experiences where you felt really, really vulnerable, and you called healthcare. Can you tell us a bit about that?
Yeah, at one point when I was coughing a lot, I didn't know what was happening to me, so I thought I was getting a bit scared, and I spoke to one of the staff members. I was telling them that I needed to see healthcare as soon as possible. And obviously after that they've taken like 2 hours. They came literally. They came 2 hours later to see to check up on me. And when she's when the healthcare checked up on me, she said to me that I'm going to be okay as I am young and I'm fit. And she also gave me like a paracetamol.
Mm. I mean, at that time, you must not have felt very young and fit. It must have been awful.
Yeah, that's right.
Yeah, but thankfully you recovered. What was the impact on your family at the time that you were ill?
When I told my family that my contract was COVID-19, they were really worried.
Yeah, I bet. I'm going to ask you a bit about the conditions in prison during the pandemic. How regularly were you able to leave your cell?
During the lockdown, I was stuck in my cell for 24 hours because we was on lockdown. Obviously the education initially before the lockdown, I was attending education. When the lockdown come, I couldn't do any learning. Also, there was after a while they've changed the 24-hour lockdown to 23-hour. So we get an hour and 30 minutes for a shower and a half an hour for exercise.
Okay, so it was either 23 hours or 24 hours. How long did the 24-hour lockdown last for?
It lasted about a month.
About a month. And in that month, were you able to access the shower regularly?
No, we couldn't. We had to have like a pad wash, so that we had to use like the sink.
Yeah. That's pretty awful.
Yeah.
And so you were just confined to your cell for that long, for 24 hours a day?
Yes, that's right.
After you'd served your sentence?
Yes, that's
pretty outrageous. Did members of staff wear masks and gloves?
Yeah, they did after the lockdown. They were wearing masks and gloves.
After the lockdown?
Yes.
And were detainees given masks and gloves?
Well, not at first. When the lockdown first started, they didn't give any to the detainees. But after that, I'll say 8 months afterwards, that's when they handed out like masks.
So 8 months after the first lockdown was when detainees had access to masks and gloves?
Yes.
Okay. What would you say if the Home Office were to say to you that they made prisons as safe as possible?
I would say even before they gave out masks, I didn't feel protected. Because I still contracted COVID-19 before they gave us the mask. Yeah, it wasn't safe.
So you didn't feel safe at all, and understandably, because you've got COVID-19, even though you were very vulnerable. How did you get out of detention in the end?
I think because I contracted COVID, and it made me very sick, and obviously the BID has tried to get me released as well, and also I think they referred me for unlawful detention, and because of that, I think the Home Office decided to release me.
So the Home Office decided to release you. So their decision to detain you was pointless all along then?
Yes.
Yeah. And just finally, what has been the impact of the Home Office's decision to detain you during the pandemic and for so long?
Because I was supposed to get released on February. I thought I would get released in February. I didn't know that I was going to go through this for the immigration system. Initially on February, when I thought I would get released in February, I could have continued doing my apprenticeship, and obviously they've kept me during my after my release date. I couldn't do my apprenticeship, and also when the lockdown come, I couldn't do any learning in prison because of the lockdown, and I couldn't see my family.
Yeah. It sounds awful. Thank you so much for sharing your experience with us. We're really pleased that you've been released finally, but we're sorry that you had to go through it in the first place.
Sure.
So, Mr. A, thank you so much for speaking to Rania. I think it's really important that we hear from detainees just exactly what their experiences are like and the impact that it has on them. And we'd like to wish you best wishes for the future. And Rania, thank you for conducting that interview. It's really helpful to us all in our understanding. So now I'd like to move on to our second speaker, which is Adam Spray, who's an immigration solicitor specialising in immigration, refugee and human rights law. Adam's been with BID for 2 years, and he manages our Right to Liberty project. That's a small casework team that represents vulnerable adults in immigration bail applications, to try and secure their release from immigration detention. His client base is made up of victims of trafficking, torture survivors, and those with mental and physical health conditions. So, Adam, would you like to speak to us now?
Thank you very much, Maggie. And thank you again, Mr. A, for that first-hand account. I think it really brings to light a lot of what I'm going to say in a way which you know, someone who hasn't experienced it firsthand, I can't do, frankly. So my name's Adam. My job at BID is to represent people and try and get them out of immigration detention through applying for immigration bail. I'm going to talk this evening about my experiences of applying for immigration bail during the pandemic, and also give some reflections on the response of the Home Office. So we all know how much the pandemic has changed the way we live our lives. And I think it's true to say that it has had as a profound impact on the world of immigration detention and bail. One of the things I think about one of the things I think the pandemic has done in a kind of broad sense is expose areas of society that aren't functioning very well, made those more obvious, and then in many cases actually exacerbated those existing problems. And I think that's a good kind of narrative for the story of the pandemic and immigration detention. So I'm going to start just by giving a kind of brief chronology as to our work and how it interacted with the pandemic. And if we cast our minds back to kind of early March 2020, as the number of cases of COVID in the UK increased, it became apparent to us at BID that the spread of COVID-19 and the pandemic was going to have serious consequences for those detained under immigration powers. And there were really two reasons that we thought this at first. Firstly, people in detention are largely unable to socially distance. And we knew that because this was a highly infectious disease, There were concerns about it getting into detention centres and then exposing detainees to the risk of infection and all of the dangers that that brings with it. And secondly, we believe that because of the restrictions that were in place in international air travel, this brought into question the legality of the use of immigration detention, as many people clearly couldn't be removed. So it's a well established that the Home Office's power to detain pending deportation is limited by the fact they have to only use that power to facilitate the removal. And in this instance, where clearly people couldn't be removed, it begged the question why lots of these people were still detained. So in order to address these issues, at BID, we got together with a number of other organisations and we wrote to the Home Office, and on the 11th of March, we sent a letter basically asking for everybody who was detained under immigration powers to be released immediately. And, you know, I understand that could be seen as a slightly ambitious request, but we do believe that it's simply unacceptable to place detainees at risk of infection of a deadly disease solely for the administrative convenience of the Secretary of State to carry out her duties. That balancing exercise for us just doesn't make sense. So it was kind of the only course of action that we saw as being appropriate. And when I said earlier that I thought the pandemic had kind of revealed problems in society, I think this was a good example, because the Home Office didn't release everybody. And by not releasing everyone detained under immigration powers, they did it, in my view, they revealed an indifference, not just to the well-being of the detainees who are being held, but also an indifference to the entire public health effort, because clearly if COVID got into the detention centres and the prisons and spread, that was going to undermine the public health effort at large. But in having not released everybody, the Home Office did kind of take two main steps to try and address the problems which COVID faced for them. Firstly, they undertook a review of the decision to detain everybody who was detained under immigration powers. And secondly, they issued guidance on how staff in the detention centres and in prisons should conduct themselves to try and minimise the spread of the disease within those establishments. And I would suggest that to a large extent, both of those practices failed. And what I'm going to do now is explain my reasons for thinking that. What I'm going to do quickly, I've only got a couple of slides, but let me know if you can see this. Is that showing? Yeah, okay, so one of the first things, sorry guys, if I put this up, can you now see this slide, or can you see my Word document? Okay, right. So one of the things, so this letter, basically what the Home Office did is they undertook a review of everybody's immigration detention, and this was explained in a letter which was sent by a senior civil servant at the Home Office to the tribunal. And as you can see, it says the Home Office has, since the emergency begun, reviewed the cases of all of those who were detained to ensure that, in their view, that detention remains appropriate. And they make reference to the fact that the decisions were made in line with existing policies. They make reference to being mindful of the vulnerabilities of detainees, particularly with reference to COVID-19, and also the likelihood of achieving removal in a reasonable period. I'm going to stop sharing that now and go back to this. What the letter also said is that as a result of this review process, the numbers detained in IRCs, and Pierre alluded to this earlier, went down from, I'm using different numbers, 1,225 1st of January 2020 in detention centres to then 368 in the IRCs on the 21st of April. So quite a sharp decline there. Strangely, the numbers of people detained in prisons actually went up by about 40 or so over this period. But, you know, on the face of it, we kind of welcomed this relatively large scale release, even if it didn't include everybody. Unfortunately, what we found in the coming weeks and months after that letter was sent is that in the cases where the Home Office hadn't recommended release, there appeared to be systemic failures within the review procedure, and the failures failed to properly understand how the issues of vulnerability and removability brought about by the pandemic interacted with that person's immigration detention, and in almost all cases made detention inappropriate with regards to the law. These reviews, Mr. A was saying that he received one of these reviews, I think. These reviews also consistently, in our experience, overplayed the risk of offending posed by the detainees. So Pierre said in his opening speech, we did a research report which was published in May, and you can find it on our website. But essentially the findings are that, you know, these reviews which were being undertaken were fundamentally flawed in their decision-making process. And I think that the best way of evidencing the failure of these new decisions is for me to get up another slide here, bear with me. So what this slide shows is, you can see that, yeah? Yeah, what this slide shows is bail outcomes of all bail applications in the first tier tribunal, 2017, 2018, and some of, but not all of 2019. And the blue one here is those applications which are either refused or withdrawn, and the orange ones are those applications that were granted. And I think what you can see is a sort of generally broad, consistent, about 32, 35, 29% of bail applications before the pandemic are resulting in grants of bail. The pandemic comes along, and in response, the Home Office undertake this review of everybody's detention. And so in the absence of assuming that the tribunal is addressing these issues differently, and assuming the Home Office are going to make correct reviews, you might not expect to see too much change in that percentage. But these stats are slightly different because this is just our bail applications now. We don't have the figures for everybody. But what we had since the lockdown in March, so since these reviews have happened, is that we've now got 77% grants and 23% refusals or withdrawals. If you take out the withdrawals, the percentage goes up, as Pierre was saying, to 90%. So it seems evident in itself, by virtue of how many bail applications were succeeding, that the reviews the Home Office were undertaking were just wrong, frankly. Bear with me one second. So, yeah, bear with me. So I think the only conclusion that can be drawn from that, in the absence of any evidence to suggest that the tribunal had altered its approach, is that the Home Office's review of detention during the pandemic was not consistent with how the independent courts understood when immigration detention is appropriate. So what do the Home Office do? They're now in a position where they're losing much more bail applications than they would expect to, much more than ever before. And you might expect that there would be a degree of contrition on behalf of the Home Office, as you know, they were warned this might happen. You might expect an internal review of their decision-making process. But what actually happened instead is that a senior civil servant from the Home Office wrote to the president of the tribunal to express, amongst other things, their surprise at the level of grants of bail from the tribunal. And I don't know how many among us have read the letter, but I've read it a few times. And the only conceivable reason I can see for that letter being written is that it's the Home Office were hoping to influence future decisions of the tribunal. And again, I think this is the revealing of the mindset of the Home Office. I think it shows two things. On one level, it's like a failure to understand the principles, some of the basic principles and limitations of immigration detention. And on another level, it shows how, when they're not getting their way, they're prepared to kind of throw their weight around a little bit to try and influence the judiciary. So that's a kind of summary of what I made of the review process, and I'll move on quickly now onto the summary of the of what I think the Home Office got to with their guidance. Still got 5 minutes left, great. So in addition to doing all these reviews, the Home Office also published a number of specialist guidances for how the IRCs and the prisons should be managing the pandemic within these different estates. The guidance acknowledges that there are people in the detention estate who are vulnerable to contracting COVID, but laid out steps that should be taken, ideally to prevent the disease from entering the centres at all, or in the event that it does, prevent the disease from spreading. And I think that the best way of judging the success of this guidance is to look at whether or not it achieved its goals. Did it stop COVID entering the centres? Did it stop it spreading within them? And with respect to this, I'll talk first about the IRCs, because at different times we have been made aware of a number of individuals who have tested positive for COVID in Harmondsworth, at different times in Morton Hall, and I understand that an outbreak of COVID in Brook House resulted in the entire centre temporarily closing because it was posing such a risk. And I've got to say that those events aren't surprising to me, as I have heard many anecdotal accounts from speaking on the phone to clients who are detained in IRCs, from individuals complaining about insufficient hand sanitizer, insufficient face masks, lack of gloves, failures to follow social distancing by detainees and by staff, and also a failure for enforcing if people do break social distancing rules, there are sort of no consequences for that. And just mirroring what Mr. A says, things like gloves and masks coming too late. So it was no surprise to me when there were cases of COVID within the detention estate. And on top of that, we had a position where there were extra barriers to obtaining legal advice to those detained in the IRCs, because the legal aid duty solicitors who usually go in for face-to-face interviews to meet with detainees and take on these cases, those were suspended and they were happening over the phone. So that, just those technological barriers made it more difficult for people to engage with that. So at different times, social visits were banned altogether, and at other times they were greatly restricted, as was access to the libraries and to the internet at times of lockdown. So all of those things together obviously really have implications for detainees' ability to engage with any substantive case that they might have going on, and put them at a disadvantage, as well as interfering with their family life. So those are the kind of effects that I can describe and explain, because they're sort of clear to see. But of course, what's more difficult probably for me to get across is the anxiety that having the COVID in the detention centres caused the detainees there. We were often speaking to people on the phone, and their fear of contracting it was palpable, and they were aware that their power over what they could do about it was very, very limited. And it's difficult speaking to people who were kind of forced into such a position. So that paints a pretty grim picture of how the guidance for how COVID should be managed in the IRCs looked in practice. But unfortunately, the situation for those detained under immigration powers, such as Mr. A was, is worse still than those in IRCs. I'm mindful I've only got a minute or so, so I'll be quick now. The Guardian recently reported that 4,800 people in UK prisons have tested positive for coronavirus, and 71 of those people have died. Now, obviously, the vast majority of those people in prisons aren't detained under immigration powers, but it is still the case that lots of our clients, a number of our clients who are in prisons, have tested positive for coronavirus. I had one client who tested positive for coronavirus. His health deteriorated to such an extent that he was transferred to a hospital outside of a prison. Thankfully, he made a recovery, but then on discharge from the hospital, he was then taken back to the prison where he was continued to be detained under immigration powers. And Mr. A did a great job of explaining what the day-to-day experience is of people in the prisons during the COVID lockdowns, you know, the 23, 24 hours a day in your cells. You know, when you are out for a short amount of time, there's difficult choices to make. Are you going to exercise? Are you going to have a shower? Are you going to contact your solicitor? Are you going to contact your loved ones? Really not positions that we should be putting people in. And yeah, I'll just speed through this last bit. I mean, the pandemic has also exacerbated other problems, long-standing problems like a shortage of accommodation for people with who need it to get out on immigration bail, and again, that is extending the length of time that people are remaining in immigration detention. And so, like, to summarize this prison issue, I think there are complicated questions about how best to manage time-serving prisoners in the age of COVID. But in this context, we're only talking about people who have finished their sentence, people who, if British, would have been released already, yet remain in prisons under the most draconian and restrictive lockdown regimes, often when it is impossible for them to be removed anyway. And, you know, simply it's BID's position that is always unacceptable. So just very quickly, because I've pasted a pretty negative, pretty depressing picture. There's lots of bad things, but looking forward, BID is excited about new projects going forwards. We're going to be looking to campaign to try and get immigration detainees prioritised in terms of the rollout of a vaccine, and we're excited about maybe expanding our work to work more closely or represent individuals who are housed in these new kind of quasi refugee camps, BARAC situations. So, you know, it's been a tough pandemic, but, you know, there's plenty of work to do, and there's new there's new areas that we're going to look to help people with. So I'm sorry I went on a little bit longer than I should, but thank you very much for listening.
Thanks, Adam. Well, you had quite a lot to say, so not surprising you went on a bit longer. So thank you very much on that. So now I'd like to introduce Dr. Juliet Cohen, who is the head of doctors at Freedom from Torture, where she's worked since 1997. She's responsible for maintaining the quality and capacity of the medico-legal reports service. She's forensically documented evidence of torture for over 1,000 individual survivors. Dr. Cohen's an international authority on issues such as reasons for late disclosure of torture and the effects of immigration detention on survivors of torture. So, Dr. Cohen, over to you.
Thank you very much, and thank you for inviting me to this meeting. I've been asked to talk particularly about healthcare in immigration detention, so I'm going to focus on that and also talk particularly about the impact of that detention being indefinite, and then a little about the specifics of the COVID-19 crisis. So in terms of what we know generally about healthcare in immigration detention, it has a really poor record. There are repeated adverse comments from inspections by HMIP, by the independent monitoring boards. Stephen Shaw made 2 reports. There's been a lot of litigation, and currently we have an inquiry about the awful practices that went on at Brook House. And that's ongoing at the moment. So I have direct experience of working with immigration detainees. I've visited most of the IRCs over the years, And so unfortunately, I have been able to see firsthand the impact of that detention on people and seen the deterioration in their mental health, been able to compare it with how they describe, and sometimes I've met the person before they went into detention, when they were in detention, and then been able to review them sometime later after they were released from detention. And it's really horrific, frankly, to see the devastating impact that detention can have on a person who may already have some vulnerabilities, but the pressure and the stress of detention can really just destroy them mentally. So we've seen that there are difficulties for people to access healthcare, to receive a proper, competent, full assessment of their needs, and to get the treatment that they need. I've seen people suffering serious self-harm and suicide attempts, and we know that sometimes, sadly, those attempts succeed, and there have been many deaths in immigration detention. So you have to ask yourselves, what's going on? Because these healthcare centres are staffed by qualified doctors, qualified nurses. They have in recent years been subsumed into the NHS, so they're ostensibly under the control, the guidance, the management of the National Health Service and held up to their standards of care. The Care Quality Commission go in and inspect these places. So why is the healthcare there still so appalling? I've looked at a lot of records and spoken to many people, and I've come to the conclusion that there are a lot of factors that are working against us here. There is, as in so many other areas of immigration practice, the Home Office, a terrible culture of disbelief. And I think that this is actually worse in detention than in any other areas of immigration and asylum practice. Something perhaps about the fact that people are in detention, that those working there form a sort of belief that they don't question that someone who's in detention must have done something wrong, and therefore we don't really have to believe what they tell us. And so their complaints of health problems are not properly assessed and not taken seriously. There is a failure to foster trusting relationships between healthcare and the detainees, and detainees do often say that they just feel that healthcare is part of the detaining authority, that they don't feel that the staff are really there to look after them and to put their needs first. There's a terrible failure to use interpreting services, and so many immigration detainees do not speak fluent English. And in particular, even if they can speak a level of English to get along in everyday life, it's not necessarily sufficient to convey their mental health symptoms, their anxieties and their difficulties. But interpreting service is simply not used sufficiently, and sometimes other detainees are asked to translate, which is completely wrong, because there's no sense of confidentiality and privacy about your complaints if someone that you're also detained with is being asked to translate for you. There are big training gaps in the healthcare staff. There's an assumption that they don't need much specialist knowledge. They're just providing primary care like in any other general practice, but this is really not the same as general practice. I could explain more, but I am conscious of the time. So I'll move on and talk about, sadly, other failures. There's a terrible failure to follow up once one assessment has been made to identify if that person's getting better or getting worse. And there's a policy called the Adults at Risk policy, which is meant to identify vulnerable victims of torture, amongst other groups, who may be harmed by continued detention. But most of the assessments that are made in immigration detention by healthcare are made once only. So there is no mechanism to monitor for the harm that may be developing. There's no recall, there's no review process. So, of course, they don't identify that people are getting worse and that detention is harming them. There's a basic failure to have sufficient mental health support. People wait a very long time for their mental health assessments, and the GPs tend not to carry out these assessments themselves, but to simply say, oh, I've referred them to the mental health team, and then to absolve themselves of all responsibility for following that up or seeing how long that person has to wait. And there's very poor liaison with the GPs in the community, both who may have been looking after the person before they were detained and have some detailed knowledge of that person's healthcare needs, and if they are discharged back into the community, to provide proper continuity of care, to provide an adequate supply of medications when the person is discharged. I could go on and on. We did try to do something about this. With the Faculty of Forensic and Legal Medicine, Freedom from Torture has produced quality standards for healthcare professionals working with victims of torture in detention. And this doesn't apply narrowly only to victims of torture, but to other vulnerable people and people who suffered other forms of serious harm. But we found that the IRC doctors seem really reluctant to implement these standards. And it's been unfortunately coinciding with this pandemic year. So we haven't been able to work with HMIP to try to come at the implementation of the standards from the inspection end. HMIP are very willing to work with the CQC and with us to try to get this to happen. So I hope that in the coming months and next year, we will be able to do that. It's very sad that this is necessary because it is really just a question of asking healthcare people to do their job, but they're not doing it. They need to have standards which we have set for them on how to identify vulnerabilities and victims of torture and other serious harm, to make a proper care plan and review people for changes in their conditions, to observe the proper processes for consent and confidentiality, to use interpreters, to assess mental health and mental capacity, to assess past sexual violence, to check if people are actually children, and to take proper action if children are found to be in detention when they shouldn't be. And most importantly, to consider the role of the healthcare professional in the assessment for detention processes. So these are the assessments that they make for continued detention, for the use of segregation, and for flight, for air travel. And most of these assessments are done very poorly, very sketchily, and without any proper consideration of that person's vulnerability and health needs that might make them unfit for these detention processes. Essentially, the quality standards remind the healthcare professionals of their basic duties and the principles of the Mandela Rules, which are the United Nations minimum standards for the treatment of prisoners, and also reminds them of the right to rehabilitation of torture survivors, which cannot be effected while they're detained. I'd just like to touch really briefly on the fact of immigration detention being indefinite, and whether in fact we should be making more of a fuss about this indefinite nature and the fact that it could really be seen as cruel, inhuman and degrading treatment. Most states, including the EU, have time limits on detention. It's pretty much only the United Kingdom and Australia who have still got indefinite detention. And there's a lot of evidence about the harm that this causes. So we know that detention is harmful to mental health of itself, and that suffering caused can be very severe. And we know that the detention is a result of a specific decision by the state, the Home Office, so there is intentionality there. But that indefinite quality of immigration detention, which really ramps up the uncertainty, the fear, and the sense of powerlessness for the individual, this is what really exacerbates the mental health conditions and causes such suffering. I can't, unfortunately, give you the source for the quote, but it was a very powerful one. Somebody said that with an ordinary prison sentence, you count down the days until you're released. But once you're under immigration powers, you can only count your days upwards because you have no idea how high it's going to go. I'm really conscious of the time. I'll just touch perhaps on the additional risks of COVID, but we have already talked about them, and Mr. A was very eloquent about this, the impossibility of distancing, the being confined to a small room. He was confined for a month continuously, 24 hours a day, which is effectively solitary confinement. Under Mandela rules, 15 days is thought to be excessive and to comprise cruel, inhuman and degrading treatment. He was there for 30 days. So this is just very, very damaging of itself. and the larger risks of individuals contracting COVID, risks to the staff, to healthcare and the wider community, the hospital staff who have to care for people who need admitting. All of this could have been avoided by ending immigration detention during the pandemic. And finally, as Adam mentioned, the Army Barracks accommodation, which is essentially opening of open prisons and keeping people in these prisons now. There are the barracks, Penally and Napier, Yar's Wood is being converted, and I hear that other sites are being planned to convert into this because the Home Office has failed to resource enough asylum accommodation, failed to move people through by actually making decisions on their claims so that they could move into the community. This is why they've got such a shortage of accommodation. It's not because the numbers of people seeking asylum have gone up in the past year, they've gone down. It's the fact that the Home Office is so incompetent at actually moving people through the decision-making process that they've run out of the accommodation they had resourced and are now having to use these sites which are so unfit for people to live in. They are, just because they were once used by the army doesn't mean that they're in any sense fit for habitation now. And people are getting sick, they're self-harming, they're trying to kill themselves, and they're now catching COVID in increasing numbers. So I really urge anyone who can to support the calls to have these places closed down. I think I might stop there before we run out of time. Thank you so much.
Thank you, Juliet. Sorry, we seem to have put all our speakers under too much time pressure when there's obviously so much to talk about, but thank you for sharing your experience with us. So now can we move on to our final speaker, Zita Holbourne. Zita is the co-founder and national chair of Black Activists Rising Against Cuts. I have to say, most of the things that Zita has on her CV have really long names. And she has a very long list of activities, things that she's involved in. So, hi Zita.
Hi.
So, Zita's an award-winning trade union, community and human rights campaigner and activist, an author, visual artist, curator, poet, vocalist and writer. She's co-founder and national chair of Black Activists Against Cuts, a founding member of the Movement Against Xenophobia, BME Lawyers for Grenfell and BAME Lawyers for Justice. And she's played a leading role in campaigning against the Windrush scandal. Her political views and opinions are regularly featured in print and broadcast media, and she's a regular writer for news sources including The Voice, The Morning Star and The Guardian. With that long list of things that you're involved with, I'm absolutely delighted that you found time to come and talk to us tonight. Looking forward to hearing what you've got to say to us. Thank you.
Thank you for that big introduction as well. Greetings everyone. So I've been campaigning against deportations and detentions for a long time in my role in BARAC, but also with other organisations. So BARAC was a founding member of the Movement Against Xenophobia, which was established in 2012 to oppose the immigration bill at the time that was coming in. And at that time, we were warning that that change in law, the amendments to the existing law, were actually going to impact on what became known as the Windrush generation and their descendants. So these types of deportations have been going on for quite some time. And they have devastating impacts, not just on the individual concerned, but also their families. And what we've seen is that there are people that have been detained repeatedly because, they'll be back in touch with us when they need support or it happens again. So I know of a number of people that have been detained 3 or 4 times, and it's almost like an annual cycle that they're experiencing. Whereby they're detained, they're told that they're going to be deported. Their legal representatives are able to get them off the plane, sometimes at the last second. Some people can touch the plane. Some people have been seated on the plane before the situation is reversed. So you can imagine the trauma that not only that individual is going through, but also their families. And I have been up in the early hours of the morning talking to people in that situation, and it's really, you know, if I find it distressing and stressful, you can just imagine what the people who are on the receiving end and their families are going through. So to have to live like that, and that continuous cycle of threat hanging over you, is horrendous. So we have people that contact us, or even on social media, they'll say, I'm going to sign in at the Home Office tomorrow. And when we, especially when we know that there is a deportation flight being planned, they'll say, if you don't hear from me, you know, in a couple of hours, please, you know, find out what's happened. They're terrified. So even in the run up to going to sign in before they're even detained, that becomes a traumatizing experience. On the other hand, where people have been signing in regularly with the Home Office, and it could have been going on for years, and then they're suddenly snatched, that's also, you know, quite shocking and horrifying. The charter flight that went to Jamaica in December, there were people who went with their families and their children. And so in one case, the partner of a man that was taken was sitting outside with their children for 2 hours, just thinking it was just a really delayed and long process, not knowing that they had been taken. In a previous flight, somebody had their baby with them, but there wasn't any other adult there, and they handed the baby to social services. So rather than allowing the person to call the other parent to come and collect their child. So the trauma and the distress and the impact on mental health isn't just on the individual that's been deported, but also, or detained, but also on their family. And Juliet mentioned a quote, and actually everybody that we speak to who's been detained, who has also previously been to prison, say to us that actually being in detention is far worse than being in prison, because in prison, you know how long you're sentenced for. You know when that ends, then you should be able to leave, or you expect you're going to leave. But as we've heard from Mr. A, that doesn't always follow, that your sentence comes to an end when it should. But with detention, you don't know how long you're going to be there. You don't know if you're going to be snatched in the middle of the night. And if you've previously been convicted of a crime, how you're taken when you're taken to go on a flight is different to somebody who hasn't previously hasn't been sentenced. Because if you've been in prison before, they will wake you up roughly, bash down the door, drag you up and snatch you up and take you, rather than knocking and saying, okay, it's time to go now, and giving you a bit of dignity. So even in the way you're treated, you're still being judged by that previous sentence. And with this particular flight, we saw during last year, there was a relaxing of having to sign in, and also people were released from detention. So it became even more shocking and frightening and unexpected for people, because they were not expecting, in the middle of a pandemic, to be taken in that way and to be detained. And there were people that were contacting us who were taken directly from prisons, and other people signing in. There were people saying that, you know, family members saying that immigration officers had come to their house trying to track down the individual. And that's frightening for a family, you know, going to a mother's house or a partner's house and saying that we're trying to track down this person and look for them. And in the middle of a pandemic, when Black people are contracting and dying of COVID disproportionately, actually because of systemic racism and discrimination that they've faced for many years in the UK, it's even more horrific. And people I was speaking to were saying that, I was asking them, have you been tested at all for COVID when you were taken from prison or when you were taken into detention? And they were saying no. In some cases, they might have taken their temperature. They said wearing of masks was very relaxed. There's interaction because everything's communal. So on one hand, there was nothing to protect them from the virus, and to ensure that they had safety and distance, etc. And it was erratic in terms of having access to PPE as well. But at the same time, access to legal representation was limited, with the reason given as COVID, because, for example, the computer rooms in some detention centres, where people will access the phone, the computer, to do some research on their case, to try and make contact with a legal representative and get support, were locked or restricted in detention centres on the grounds of COVID. Yet other activities, eating was all communal, and there were no restrictions. And people didn't have very long in lots of these cases between being detained and being deported. And when you talk about having had a prison sentence, for example, then being detained, then being deported to a country that you don't even know, because in most cases, as Mr. A said, people came when they were children or when they were young adults. So they would have spent either their entire adult life in the UK or the majority of their adult life in the UK. And there was a private deal between the Jamaican government and the British government in the lead up to this flight that those who were under 12 wouldn't be detained, because obviously campaigners like ourselves were highlighting the fact that many of the people came as children. But how do you cut off who's a child, as 11, at 12, at 13, 14, 15 to 18, you are still a child, you're still a minor. So that's quite horrific. Whilst it was positive for the individuals concerned, it meant that they weren't going to be deported on this particular flight, it's not acceptable that any other children weren't. And some of these deportations have happened to children who have never, young people who have never been convicted of a crime. Under Operation Nexus, young black men in particular, who have been disproportionately stopped and searched because of institutional racism in policing and in the criminal justice system, have been deemed to have to be guilty of the reason they were stopped, and they have been deported. And there's very little said about those individuals. And it's a lifetime conviction. So once you're deported, because there's a stigma. And when we're talking about COVID, families weren't allowed to visit people. So that basic human right of being able to see your loved ones physically and say goodbye to them, that was gone because people were barred from visiting. There were no COVID tests before people were taken on the plane, no COVID tests when people arrived. Since then, there's been a detention centre that's had to close down because of COVID outbreaks. I remember one person saying to me that the person in the cell next to them had COVID and they were crying out for help. They didn't know they had COVID, but they knew they were unwell and they had symptoms. And it was only when they collapsed on the floor that an ambulance was called for them. And there was nothing to do a special clean or industrial clean of the area. It was left to individuals to try and use what a personal hand gel or something like that that they had, or wipes, to try and clean up the area. So there was no attempt to try and protect people. And as we know, at least one person did have COVID when they arrived in Jamaica. And for the families left behind, there is a psychological impact, but also a financial impact. So when you're talking about the middle of a pandemic where people who have no recourse to public funds, who may have been allowed to work in the UK, but are not allowed to claim any benefits or any government measures for COVID, losing one person who was bringing in an income and helping with childcare, for example, because the vast majority of people had families and children, means that the person left behind is really going to struggle, because there's already COVID restrictions in terms of trying to get a new job is going to be difficult. We've seen statistics in the last week that tell us what we already knew, is that Black people are losing their job disproportionately as well because of the pandemic, and because of systemic racism that existed before the pandemic and 10 years of austerity. When Black people lose their jobs, it takes them far longer than anybody else to get a new job because of the discrimination in the labour market that already existed. And obviously the industries that Black people and migrant communities are more likely to work in have also been hit hard by COVID. When we talk to families, and I've spoken directly to some children, and I spoke to one little boy who was saying, am I next? Why does this government hate Jamaicans? Are they going to deport me next? Are they going to deport you next, Mum? And children wetting their beds, doing badly at school, having bad dreams and nightmares, not being able to concentrate, clinging to the parent that's still with them because they're worried and scared that that parent is going to be taken away. There are lasting impacts on those children. I know from the past, children have failed their exams and done badly in school. Of course, that has a knock-on impact on their future prospects and their future careers. So you're talking about this causing trauma and financial and social and psychological impacts, not just to that person, to their entire family and future generations. And we shouldn't forget that these are the descendants of the Windrush generation, and they're receiving, if they have been criminally convicted, we shouldn't forget that there are more Black men in prison than there are in university in the UK because of discrimination. The criminal justice system discriminates against Black people, and then Black people are more likely to get a harsher sentence than white people for the same offence. So that discrimination has a knock-on impact. And the reason why people are in the UK, whilst they're being branded as illegal immigrants, is because of that link to Windrush and the Windrush generation who were invited to come to the UK, is because of Britain's history of colonialism and empire and enslavement. And so we shouldn't forget about those links. And for those who are deported, the stigma attached to them because they've been branded as this hardened criminal guilty of the worst offences, which in the vast majority of cases is not true, means that they are isolated and they are destitute. There are people that have taken their own lives when they've been deported. And in addition, nobody wants to give them a job or work with them. And in the middle of a pandemic, there's less opportunity in a country like Jamaica than at any other time. So the trauma and the distress and the discrimination and the breach of human rights is not just impacting on one individual. This has been paining the whole of our Caribbean community and Black communities, because if we look at the majority of people that have been targeted for deportations, it is people that are from the African, the Asian, the Caribbean regions. And yes, because of Brexit, the UK have been targeting, for example, Eastern European migrants as well. In the run-up, and we saw more mass deportations in December to European countries. In fact, the government were getting people and putting them on one plane and then doing 2 stop-offs. So they were deporting to 2 or 3 countries at a time with a plane load of people. And what they do is they round up what I would describe as low-hanging fruit, people who are complying with the system, going through appeals, trying to regularize their status. And then in terms of the people who are the Windrush generation and what happened to them, of course, they were told that they're part of the British Empire, they're British citizens. The government tore up the landing cards and the evidence of where and how they came in, and then branded them illegal immigrants after they've been paying taxes and contributing to British society for 30, 40 and 50 years. And I think I'm probably out of time now, aren't I? So I'll stop there.
So thanks, Zita. Yeah, you probably are, but I understand that you also need to leave us because you've got something else to go on to. So thank you. That was absolutely brilliant. Thank you very much. Right. So now I'm aware that we're going to move on to the questions and answers. The first question that I've got in front of me is actually for Adam. So Adam, do you think the absence of immigration legal advice to immigration detainees on prisons and now in the camps is challengeable? It's a question from Detention Action.
Thank you, Detention Action. I have thought that the lack of, I mean, speaking frankly, we haven't started work in the camps yet, so I'm just not qualified to comment on the access to immigration advice in the camps. With regards to the lack of access to legal advice in immigration prisons, on the face of it, that seems to me like an appalling lack of access to justice. But I'm also aware that numerous law firms, I think Duncan Lewis, have kind of looked into bringing challenges against or related to this particular issue. And as far as I'm aware, they haven't had a lot of luck so far. I think that the courts have been quite generous, I think, to the Home Office in construing what access to legal advice looks like, and so far they haven't had much success. But I mean, I still, just to my mind, it seems like a strong argument. I don't know if you've got anything to add, Pierre. You're on mute. You're muted.
I think for sure. I mean, if you, well, the first thing is to say that I've heard it said that what's been happening in the camps, there has been a statement by one Home Office official that advice is not required by asylum seekers there when they're only about to enter the process, which is just absolutely extraordinary thing to say for people who come from Syria, Algeria, or anyone whose immigration status is not certain. Everyone needs legal advice. And I think the courts have, over the years, the first intervention BID took was back in 2004, which was in the case of ID, 2006, sorry. And in that case, it was very clearly found that, legal advice is necessary. And asylum law has become so complex over the years that it's evident that people will not understand how they're meant to convey, what they're meant to convey in terms of their claims and their immigration history generally. I mean, if you just look at, the camps are about asylum seekers, but if you look at prisons, deportation is so complex that to try and understand how you're meant to convey something like the concept of unduly harsh, where it's you're allowed to be cruel to a child or to an adult, but not excessively cruel, and how you're going to convey that in legal terms in order to have a possibility of winning your case, and how you're going to evidence all of that. I mean, how's anyone going to really understand that? So I think that with the camps, we've got a chance of building up the evidence, and Adam's going to be very much involved in that work, and the evidence is going to be more on the obstacles to gaining advice, rather than having to rehearse the argument, as the Home Office seems to be constantly trying to do, whether or not advice is required. I think that the courts will turn around on that argument and throw it out, although we'll probably have to rebut it because the Home Office keep on saying
it. Thanks, Pierre and Adam. So we've got a second question, which I think is perhaps a question for Juliet. How much of Home Office insensitivity is to do with the I've just realised I've read the wrong one. Have in the past had to call an ambulance for a client and it's been turned away from an IRC, What can be done in this case? Calling an ambulance was my last resort and I didn't know what else to do.
Yeah, and unfortunately, that's not the only time that sort of thing has happened, because I've spoken to people myself whose friends tried to call an ambulance when healthcare wouldn't attend to them. And it's really difficult because healthcare will retain control and not allow an ambulance paramedics to access the IRC unless they really feel they can't cope. So it's very difficult, I think, particularly from outside detention, to do anything. I don't have experience myself of what happens if you would try to call a second ambulance, for example. I know if people in detention do have a phone, then they can try to call, and they have done that. Sometimes the paramedics get in, but unfortunately, sometimes they're turned away, and the healthcare that people are left with is, as I've said in my talk, often really inadequate.
Pierre.
Yeah, I'm just recalling a case that we intervened on quite a few years ago, which related to disturbances at Harmondsworth, which led to detainees trying to call ambulances and also the fire brigade, and in the end managing to get through to BID, and BID called the fire brigade and the ambulance service and got them involved. And the delays that were incurred there led to accusations about of human rights violations. And in the end, the Court of Appeal found that the Home Office should have conducted a public inquiry into Article 3 violations. So I think the first thing is, you know, if you have grounds to believe there's an emergency, you have grounds to call the emergency services. You might have to answer for why you believe that to be the case, but you should keep good records of the steps you take, and that will at least show that you did what you can to bring something to the attention of the Home Office, and any failures on the part of the authorities then can be addressed, and the situation can be escalated. It's not to say that you can solve the situation there and then for sure, but you can only do so much given that you're not in detention and you're a member of the public. But at least there are, what you can do is make that call.
Thanks, Pierre and Juliet. Well, I'm now the one who's going to say I'm afraid that we're rather running out of time. And so I'm sorry, we're not going to have a chance to get to the rest of the questions, but thank you for posing the questions. Just like to say thank you again to all the speakers and to all the BID staff who've put this programme together tonight, perhaps particularly Elisa, who's been on the high stress levels, making sure that not only all of us human beings work together, but also that the technology worked as well. So thank you, Elisa, you've done a great job. But before we finish, I'd just like to introduce you to BID's new director. Many of you will know that at the end of last year, Celia Clark decided to stand down from her role as director after being with BID for 15 years. So I'm sure all of you who knew Celia would like to wish her best wishes in her future life. And I'm sure that many of us will still see her at some stage, and I'm sure she'll keep in touch with BID. She's going to be a very hard act to follow, but we're very delighted to welcome Annie Viswanathan, who comes to BID after many years of working in immigration, in the immigration field. And so I'd like to ask Annie to just say a few words and to close tonight's meeting for us. But thank you all for coming. We really appreciate your support, and we hope that you found the evening interesting, if not always enjoyable in terms of what we've heard. So thank you. Annie?
Thank you, Maggie. I will be very brief, and the first thing I want to say is it's a real pleasure to be here. This is a dream come true for me. I'd like to thank all our speakers, Maggie, Pierre, Adam, Aranya, Juliet and Zita, but most importantly, Mr. A, whose dreadful experience is illustrative of the cruelty of immigration detention. I also want to thank Celia, who's given me so much time in order to make this handover as seamless as possible. I'm really looking forward to working with a very, very talented team of people to end what I think is one of the most barbaric practices in the 21st century. So this time next year, I'm sure I'll have a lot more to say. Anyone wants to contact me, Annie@biduk.org. Please feel free. Thank you. Bye-bye.
Thank you, everyone.
Thank you. Bye-bye.